I'm Savannah Masillo.
I'm Riley Jeffy.
I'm Allie Perot.
I'm Anna Powell.
I'm Seth Pentecost.
I'm Emily MacArthur.
And we conducted a literature review looking at cluster B personality disorders in relation to crime. Our research problem is, does a diagnosis of a cluster B personality disorder increase the likelihood that an individual will commit a crime?
This research problem has clinical significance because it allows nurses to better advocate for their patient and get a holistic picture of their diagnosis. It also reduces wrongful convictions and assists in establishing effective rehabilitation programs for those with mental illness. It also identifies discrimination among minorities regarding mental health and the stigmas associated with it.
Our findings show that 87.3% of women and 83.3% of men had a personality disorder at the time their crime was committed. Pathological personality traits have a unique positive association with criminal thinking. A diagnosis of antisocial personality disorder correlates with multiple incarceration rates and earlier instances of criminal behavior.
There were several limitations that we found in the studies. Many of the studies were conducted outside the United States with different prison systems, thereby impacting continuity between the studies. There were also several studies limited by gendered populations or age groups.
Also, different personality measurement tools were used across studies, which may lead to inconsistent results or false generalizations. Some participants also failed to answer questions honestly due to the stigma surrounding their mental illness.
Overall, there was a positive directional relationship between a diagnosis of cluster B personality disorders and incarceration rates. Presence of a personality disorder increases the likelihood that an individual will possess traits such as egocentrism, violence, impulsivity, and narcissism that can contribute to committing a crime. Additionally, those with a cluster B personality disorder likely will have comorbidities such as a substance abuse that increases the likelihood of committing a crime. Understanding cluster B personality disorder has implications for offender treatment and rehabilitation.
To conclude, nurses must be aware of this problem to help eradicate the stigma surrounding mental illness, as well as show empathy and provide optimal care for the patient.